Hello everyone, welcome to the Maniverse. Today we are going to explore the sagittal section of the male pelvis. We are going to move in a clockwise direction to identify the visible structures. The first one is the glans of the penis. The next is the corpus callosum. The next is the deep dorsal vein of the penis. The next is the pubic symphysis. The next is the urinary bladder. The next is the obliterated umbilical artery. The next is the vas deferens. The next is the inferior epigastric artery. The next is the external iliac artery. The next one is the external iliac vein. Over here we have the ureter. Over here we have the common iliac vein. Over here we have a common iliac artery. Over here we have the internal iliac artery. Then here we have the internal iliac vein. Right here we have the rectum. Over here we have the seminal vesicle. Over here we have the prostate gland. Over here we have the urogenital diaphragm. Over here we have the bulbus spongiosus. And last but not the least, we have the urethra, the penile urethra. Penile urethra. This is the penile urethra. This is the membranous urethra. This is the prostatic urethra. Now moving forward to the follow-up questions. Number 1, what is the embryological origin of the structure labeled A? The structure labeled A is the prostate gland, and the prostate gland develops from the urogenital sinus. So that is the answer. Urogenital sinus. Number 2, what is the length of the structure labeled D? The structure labeled D is the ureter. That's ureter. Average length of the urethra in humans is 10 inches or 25 cm. The third question, what type of joint is formed by the structure labeled C? The structure labeled C is the pubic symphysis, and the pubic symphysis forms a secondary cartilaginous joint. And then the last question, which vessel does the structure labeled B anastomose with at its termination? The structure labeled B is the inferior epigastric artery. The inferior epigastric artery anastomoses with the superior epigastric artery at the level of the umbilicus in the rectus sheath. So the answer to number 4 is superior epigastric artery. We've come to the end of this video. Thank you so much for watching. Remember to subscribe and turn on your notifications so that you'll be notified as soon as I drop more videos. Good luck.